A lot of you have been asking about supplements. What supplements should you take? What supplements work? And this is a great question. However, when I'm talking about this with my patients, I approach it from a different standpoint. I think about it more like a chef than I just do say, just take this and it'll get better. That doesn't always work, because if you think about this, if I'm baking a cake and I'm missing eggs out of the recipe, it's going to turn out awful, even though I have flour, cinnamon, sugar, whatever it may be. The same thing goes if I have a recipe that calls for 2 cups of flour and I have 2 tablespoons. And then I have to bake it for the right amount of time, and I have to do it at the right oven temperature. And this is one of the biggest mistakes if you're not getting results, why that's occurring, because supplements are great, but they're limited into what they can do. They could probably help some earlier cases if it's just starting. But if you have had neuropathy for a long time, if you have A1Cs above, 7 probably, if you've had a traumatic accident, if you've smoked and drank your whole life, then it's probably going to take quite a bit of time in order to heal the nerves. Most of my patients I'm working with for a minimum of a year. So please understand that it's not something that you're going to wake up tomorrow after taking, 1,000 milligrams of alpha lipoic acid and it's going to be better. These things take quite a bit of time, especially as you go up in age. Now, that's not a definitive, but they do take quite a bit of time in order to reverse or stop the progression. So I can't really tell you what. Now, alpha lipoic acid, menfotamine, B vitamins, herbals are great. Like they do work. However, they are just a piece of the puzzle when it comes to reversing neuropathy, to helping the nerves heal. And this goes for any pathology or anything. So don't take something, as it is and say, okay, if I do this, I'm going to get better. It might not be the case. There might be other factors that play into it. And you really have to understand that there are so many contributing factors. You can't just say that this one thing is going to fix it. So I don't want this to get long-winded. I hope that helps. If you have specific questions, please comment below, and I'll see you soon. Bye.